Hello, friends. I'm Dr. Sukhbir Singh, plastic cosmetic surgeon from Delhi. Today, we'll talk about gynecomastia and its treatment. Last, when we went live, I had spoken about hair transplant and something about how we can treat it. Let's understand what is gynecomastia and how we can treat it. Let's remove some myths which are already existent, and let's clarify the doubts which normally people or the clients ask us. So gynecomastia basically means gynec means female and mastia means breast. So basically, whenever the male breast mimics the female breast, we call it gynecomastia. Now gynecomastia is various grades, starting from grade 1 to grade 4, and depending upon how much your skin is sagged, that means whether you have a history of weight gain, weight loss, or both together. Now basically, gynecomastia consists of two components. One is the fat component, and second is the gland component. Understand that the gland component is a permanent component. Fat you can modulate or you can exercise, do a lot of gymming and all, and you can decrease your fat content. But when I talk about the gland content, it's a permanent thing. So once anybody has a gland, it cannot be removed other than surgery. So surgery is the only option that we can remove the gland. If somebody tells you that we can remove it with some medicines or some serums or some massages, no, it is not possible. Yes, fat can be reduced by good exercise. You can reshape your muscle also by good exercise and gymming. But if I talk about gland cannot be modified in any way. It has to be surgically removed. Now, why does gynecomastia occur? So, gynecomastia typically is seen in everyone. If I talk about in the age group of 16 to 18 years, when the pubertal spurt is occurring. Okay, so by the age of 21 years, it normally goes down and regresses, and you have a normal male breast shape or the male chest, which we talk about. In people in which the gland persists and does not regress after even at the age of 21 years, then it becomes permanent. Some people or some kids, if I talk about, they have gynecomastia very early. That can be attributed to childhood obesity or maybe some genetic factors. There are other some hormonal issues also which are present, which can lead to gynecomastia earlier in life and maybe needs to be treated earlier. So why do people want to get gynecomastia? Some linked to some basically causes a lot of embarrassment to people. So because of this embarrassment, people want to get the gynecomastia treated. And the only treatment of gynecomastia is surgery. Now, gynecomastia can be easily treated under local anesthesia if it is a grade 1 or 2 or maybe early grade 3. We can treat it under local anesthesia also. But as the severity of the grade increases, like grade 3 plus and grade 4, especially very severe grade 4, in which you have a lot of sagging component that cannot be treated under local, we have to take it under general anesthesia. Now, what are the treatment we have to offer for gynecomastia? So gynecomastia, basically, as I told you, there are two components. One is the fat component and one is the gland component. So the fat component can be easily taken out by liposuction. Obviously, if it is grade 1 or very glandular gynecomastia, if I talk about that means pure gland, then maybe just a gland excision with no or minimal liposuction is more than enough. But if I talk about grade 2 plus and grade 3 and grade 4, obviously, we have to have a liposuction combined with a gland excision. So, gland excision is actually the most important treatment for gynecomastia because if we do not remove the gland, that stays permanent. Fat, as I told you, can be reduced by exercise, gymming, and other activities also. But gland component, once it is formed, it remains permanent. Permanent means throughout your life, unless you get it removed by surgery. Now people are worried that we'll have big scars and might have abnormal scars, and how will the healing be? Let me tell you that liposuction just requires a 2 or 3 millimeter cut, which is on the side of the chest, and we can easily take out the fat with just one single cut. Okay. Obviously, the gland component is more. We do something called an intraareal incision or a perineal incision. That means around your pigmented skin, which is around the nipple area, it's called the areolar skin. Okay, so we make a cut around that area, a very small cut, and then we remove the gland completely out from that particular portion, and then we put stitches, which are absorbable stitches. That means from inside. Okay, so it gets dissolved with time, and the scar is hardly seen. If I talk typically about 6 weeks to 3 months down the lane after surgery, you may hardly see a scar and it blends very well with the pigmented skin. The liposuction cut, it's a 2 to 3 millimeter cut which automatically gets closed. We even don't have to put a stitch for that. So after gynecomastia surgery, we make the patient wear a pressure garment. So why a pressure garment? Because understand, when we remove the gland component and the fat component, so there's a dead space here. Okay, so that dead space needs to be covered completely so that the chest retracts back to its normal position. Okay, so for that retraction we have to make a patient wear pressure garment which will give an even pressure throughout the chest. Okay, not less, not more. So that gives even contraction, and first of all, it decreases the chance of bleeding. Secondly, it actually helps the patient to be much more comfortable. He feels much more comfortable. The pain levels are down. So pressure garment is very, very important. Okay, and second common question which my clients ask me is that, doc, when we can resume the exercise or maybe gym? So I tell them that you can resume your gym activities within 3 to 4 weeks, and then you can slowly increase the level of gymming. It's the reason that the muscle, you know, which is the chest muscle, which I talk about. So the gland is actually adhered not only to the above skin but also to the muscle. So when we release the gland from the muscle, okay, detach it from there, obviously there's a muscle edema which needs to be settled. That's why 2 to 3 weeks gap has to be given so that the muscle edema settles down and the patient is much more comfortable. It's a very simple surgery. The results are very gratifying. Patients are returned to work very early because the pressure garment is like a vest inside, and you can wear a shirt or some t-shirt over that, and the recovery is very fast and very quick because it heals very fast. Hope I've answered most of your queries. Still, if you have doubts about gynecomastia treatment, do write to us. Post your queries. We'll be more than happy to help you. You can contact us anytime. Thank you for watching.